Good morning. Today we're going to talk still about polycystic ovarian syndrome. We spent the whole month now concentrated on polycystic ovarian syndrome, and here on my one side I've got Anél Kirsten, that's a dietitian in Paarl, that's going to learn us a little bit and tell us a little bit more about diets and what we can do to improve a little bit polycystic ovarian syndrome. So my first question, Anél, is just tell our patients a little bit more about yourself and introduce yourself, that our patients know what's your background, and go ahead.
Thank you. Well, I qualified in 2002 as a dietitian, and then I went on and I did my community service year. Following that, I traveled to the UK, where I worked as a clinical dietitian in the hospital and eventually worked as a pediatric dietitian. And then I returned to South Africa in 2008, where I joined the private practice. And this is where my love for preventative medicine actually was started. So I worked a lot with insulin resistance, diabetes, and now I'm also doing nutrigenomics, or which we refer to as DNA testing. And I obviously have a special interest in women's health, i.e. pregnancy and polycystic ovarian syndrome.
Great. So my first question is going to be to you is, what diets, is there any specific diets about polycystic ovarian syndrome that can help patients, or is it a difficult one to answer?
Well, it's actually very interesting. A while ago, there was some research published in the Journal of American Dietetics and Nutrition, and they actually shown that the type of diet that you follow doesn't matter as much as actually losing weight and managing insulin levels. So when we look at PCOS, the underlying causes are very different amongst individuals, just as the hormone levels are different amongst the different women. So the most common underlying cause of PCOS are insulin resistance, and therefore the main focus of dietary therapy is to address the insulin resistance, because when the insulin goes up, it feeds to the ovaries, and subsequently the ovaries produce more androgens, or male hormones like testosterone, which then contributes or cause PCOS symptoms. So if we are able to bring down the insulin levels, we are able to manage PCOS symptoms. Now, as we know, sugar and carbohydrates are responsible for glucose and insulin spikes. So when we look at a diet, we want a diet that controls the amount of insulin and the amount of glucose in the blood. And this is where the dietitian comes in, because the dietitian would guide an individual in terms of how much carbohydrates they're allowed to eat per meal, but also within a day, based on their metabolic rates, genetics, activity level, as well as body type. So the moral of the story is there is no blueprint diet for the management of PCOS. It's actually an individual approach, and what works for the one person wouldn't necessarily work for the other. So I would say it's definitely an individual approach, and that also makes compliance better from the patient's side if you give them an eating plan that is more geared towards the individual.
Is there a specific age that you're looking at an age where you needed to see the patients, like teenagers? Do you want to see these women earlier or girls earlier, or what is the advice for teenagers that's been diagnosed with polycystic ovarian syndrome?
Look, I think the earlier we are able to intervene, the better. A lot of women, including teenagers, don't always realize the long-term health risks associated with polycystic ovarian syndrome, like you've got an increased risk of developing type 2 diabetes, heart disease, as well as high blood pressure. So the sooner we could address that insulin levels, that contributes to the PCOS symptoms, but also increases the risk of those diseases that I've mentioned, the better we are in terms of preventing disease, but also managing your PCOS symptoms. So therefore, I explain, for example, to my teenagers the importance of weight management, but also losing a bit of weight. Research has shown that you only really need to lose about 5% of your total body weight to manage your PCOS symptoms, like irregular periods, excessive hair growth, and acne, which is really most of your teenagers concerns when it comes to PCOS.
Then another question, or maybe my last question, is there any supplements that you can advise polycystic ovarian syndrome patients to take, or is there anything that can prevent? I think it's very difficult to prevent, something you have to live with. So any advice on that for patients?
Yes, look, most of the time, if we follow a healthy, balanced diet, the chances are good that you are getting all the vitamins and nutrients that you need. But research has shown that a lot of PCOS women are lacking in essential nutrients. There's also a lot of research going on looking at nutraceuticals that could also help PCOS women manage their symptoms. I think the top one at the moment would be inositol. You get actually two types of inositol. You get minoxidil and D-chiroinositol, and the two of them are really well researched. And it has been found as a wonderful way of managing symptoms. It is safe, it's well tolerated with minimal side effects. As a matter of fact, people are now starting to use it as a first line treatment in managing PCOS symptoms. Other very important nutrients would include things like vitamin D. Studies found that vitamin D supplementation could aid or produce insulin resistance. It helps with weight loss. It helps with inflammation regulation and also menstrual regularity. I think what one just probably needs to be careful with is just supplementing without having your blood levels checked. I think with many supplements, you just don't really want to be supplementing left, right, and center, because taking too much of something could also be detrimental. Then interestingly enough, a lot of women with PCOS are on insulin sensitizing drugs like glucophage, metformin, and long-term usage of metformin actually interferes with the absorption of vitamin B12. So often these women present with a B12 deficiency. So again, I would really recommend women that's on these drugs to have their B12 levels checked, say 6 monthly, 9 monthly. And should there then be a deficiency, we need to supplement with a vitamin B12. The best form of vitamin B12 is what we refer to as methylcobalamin, because it's just better absorbed. Other essential nutrients that we could look at are things like NAC, N-acetylcholine. So that also helps with the lowering of testosterone. Chromium helps with cravings, because that's often a problem with PCOS, binge eating, cravings, because of the elevated insulin levels. It is also responsible for the production of glucose tolerance factor. And then magnesium is another essential nutrient that one could look at, as well as zinc. And zinc is an important cofactor for various biochemical processes within the body, as well as the correct action of many hormones. I think just a word of caution, be very careful of just walking into a health shop or a pharmacy and just buying supplements left, right, and center. I would really suggest, again, that individuals chat to a dietitian that specializes in PCOS to give them some guidance in terms of the dosage of the supplement, because obviously if the dose is too low, we're not going to get the results we want. And on the other side, we don't want to be overdosing, because that could also have some negative side effects. Then the dietitian would also be able to advise you in terms of the best form. Like I've mentioned, you get better forms of B12, better forms of vitamin D, and then also the most cost-effective supplements. You don't necessarily need to be using the most expensive products. We want to be using the supplements that's most effective.
So what I hear, the practical side of taking this medication, they need to see a dietitian for a long time, or will you follow up like for 6 months and then make sure that they're okay, or is there not a time limit on seeing a dietitian? But I think it's very important that patients also know, just not go and buy these things and hear all these kind of words and medication that you can use. I also want you to ask you, for teenagers, how do you know? Is it like when you're 16 years old or 17, is it just overweight, or when would you see like a teenager or start with these kind of treatments with them, at the early age or not?
Yes, I think normally what I would do with the initial consultation, I think I would assess the individual, and we would try and establish where the underlying problem areas might be. And that's where blood tests come in useful, looking at their diet, doing a diet history, looking at the medical as well as family history. You need to look at the individual holistically as a whole. And then based on the underlying problems, we would implement different strategies, plan a diet, and then follow the patients up on a regular basis, because it's one thing getting a plan, but ongoing support to me is almost more important than just kicking off with a plan.
And I'll thank you for this. I think it's wonderful information that our patients getting here, and yes, mothers that's looking after teenagers, please contact Anél for advice.